VHC means some of the happiest memories of our lives. It's obviously a pretty special place for us. I was born there, and all of our kids were born there. It runs that deep, but going further back, I mean, my family's been supporting the hospital and going to the hospital for all sorts of things for generations.
Some people have an aversion to hospitals, and I walk in and I feel like it's a warm embrace. You know, I tell people all the time, if you can, go to VHC. You know, it's beautiful, and the people there are top notch, and I love it.
Our oldest, Helen, is 7. Our oldest son, Daniel, is 5, and then our youngest right now is 3.5, Samuel. All born at the hospital from beginning to end, throughout all the pregnancies and birth and afterwards. They all went well.
We found out that we were pregnant with Andrew in March, our 4th child. We were thrilled, and everything is fine and good for the first 25 weeks or so, and then we got to the anatomy scan.
They came to me around mid-pregnancy for their anatomy ultrasound, and that was the first time we met. And upon reviewing images, we realized that there were multiple anomalies. The fetus had several different systems affected that were not normal.
I could tell pretty much off the bat that, you know, the cute little baby profile it was precious to me and darling, but it wasn't what I had seen in other ultrasounds.
There were some unexpected findings on ultrasound that showed some significant concerns and differences in the development of some of the organ systems for Andrew.
We had to unfortunately break that bad news to Johanna and William. You know, it's never an easy part of our job, but we do it as graciously as we can. Sydney and I work very close together. Sydney is our genetic counselor, and in terms of once we go over that information with the patient, her and I usually meet with the patient together and really let them take the time to process, because as you can imagine, no one ever comes to see us expecting bad news.
Dr. Fursley and the genetic counselor, Sydney, came in and just outlined very calmly and compassionately the different items that she was seeing, and indicating that this was serious.
During that initial discussion, we really got to meet with the family, connect with them, and learn about what was most important for them. So they ultimately elected for one of the prenatal diagnostic testing options called an amniocentesis to gather more information and look for a genetic explanation for their son's phenotypic presentation. The results from the amniocentesis did identify a diagnosis of trisomy 18.
With all of these anomalies and having a diagnosis of trisomy 18, that unfortunately this diagnosis is not compatible with life, and there at that point we would have limited options.
They didn't really sugarcoat anything. They were honest about what the diagnosis was, what it meant typically, but that didn't mean that Andrew's life was any less important to them, or that they didn't care and that they would do whatever we wanted to do. I think we both really appreciated that that support that we got through what was a very difficult time. It was truth, it was honesty, but it was also a lot of compassion.
They were an incredibly inspiring family and always wanting to celebrate Andrew in any way that they could.
They would just laugh and cry with us, and we would jump for joy at his movements and his working on his breathing. And you know, you would think that you would kind of dread going into those appointments a lot of times, and we really didn't. We oftentimes looked forward to those doctor's appointments where we'd get to see him, we'd get to talk to the doctors and ask them questions, and it was really just a special time that VHC helped us turn him into.
I really appreciated Dr. Fursley coming in with a smile and greeting us and saying, "How you feeling? How's baby doing? How's Andrew? Let's get a look at him." We all knew that this was a severe diagnosis, and we knew how the story was probably going to end. But she was able to rejoice with us and take the wins when they were there. And every appointment when his heart was still beating was a win.
Every family looks different. Every family has different values, and you really need to get to know your family and understand where they're coming from and to put yourself in their shoes, and really just keep a non-judgmental approach, because this is their baby, this is their life.
I went into labor and went into VHC Health, labored there for about 12 hours before he came into this world, and we were in the hospital for 2 days. There was one nurse who really, it was our last day, and she went about her business of getting us out of there with such a sense of urgency. So he came home and he did great for for the entire 9 days. But that first 6-7 days was just, it was all Andrew all the time. And then towards the end, we could see that his body wasn't, he was just getting tired. He was ready. He was getting tired. He was ready. He was ready to say goodbye to us. And I held him and leaned my head back. And then he passed away in my arms. One day I'm at our children's elementary school and I see a woman coming up to me. She takes her sunglasses down and says, "Johanna? Dr. Fursley?" So Dr. Fursley's daughter is in the same school as our daughter. And I just was dumbfounded. When two worlds collide, I couldn't articulate. I was so happy to see her, but confused. And it ends up that on the spot, she said, "Well, I'm right around the corner."
I ran into her, and it was so amazing to see her outside of work, and we've become friends.
You can't train empathy. You can't train people to enter into your story and to walk alongside you. There was just a real relationship that I think is so special to VHC Health.
That's part of these people's character, to be able to walk through with that kind of kindness and love. And so it's beyond a doctor's or nurse's training. That comes from the character of the people that are there.